Hello, and welcome to the Alabama Public Health Training Network. Thank you for joining us today for our program, Towards Cultural Competence, a Conversation for Healthcare Managers and Leaders. If you have a question about anything being discussed today, please call or email during our broadcast. The phone number and email address are on your screen now and will appear again later in the program. Also, the sign-in sheet and evaluation are available online. You will need to register for this program in order to access those materials. Continuing education credits have been approved for nurses and social workers for today's program. In order to receive credit for this training, you must watch the entire program, then complete and return the sign-in sheet and evaluation form. While content may continue to be relevant, CE credit will only be awarded for 1 year for nurses expiring on May 31st, 2017, and 2 years for social workers expiring on May 31st, 2018. My name is Elena Parker Merriweather, and I'm the Minority and Special Populations Coordinator for the Alabama Department of Public Health Center for Emergency Preparedness. And joining us today is Ms. Janice Ward, Faculty Affairs Manager for the Office of the Senior Vice Provost and Communications Instructor at the University of Alabama at Birmingham. Welcome, and thank you for being here today.
Absolutely. Elena, thank you very much for the introduction. And I want to thank the Alabama Department of Public Health as well as the UAB School of Public Health for the opportunity to be here with you all this afternoon. And for everyone that has joined us today, we want to thank you for joining us. And we're going to jump right in and get started with our program for today. First of all, I always like to give a roadmap just to kind of tell you where we're going throughout the day. So we're going to start out with just an overview and some objectives. What do we want our takeaways to be for today? We're also, some of our topics that we'll discuss is understanding cultural competence fundamentals. Why is cultural competence important? Why is it relevant to healthcare? And we'll spend some time talking about, and giving you some ideas about how to get to know other cultures in during your journey towards cultural competence. Also on our agenda is effective cross-cultural communication strategies. I'll give you some ideas and share some of the literature that discusses some of those techniques that you can use to better communicate with cultures, across cultures, that is. And then we'll close up with next steps for advancing cultural competence. Where do we go from here? What are other people doing at this particular moment? So as I said, just really our overview, as I know that you all have the opportunity to ask some questions through email and other venues, other formats that have been described to you already. And what we're basically going to do is just do a run through. You'll have an opportunity for some questions. And one of the things that I will do as time permits is I will ask you all to take some notes and to answer some questions to yourself at your own time. But these are just some things that will be food for thought for you. So we're going to just go ahead. These are our objectives. Really, these are the takeaways that we want to have today. We want to leave today with just really a better understanding of how culture shapes a patient's beliefs, their health beliefs, their experiences, and how they interact with the healthcare system, with healthcare workers and providers. We want to have an enhanced and increased awareness and sensitivity to cultural diversity in a healthcare delivery context. As well, we will discuss some of the, as I mentioned, the fundamental principles of cultural competence in healthcare. That's just to help us get like a baseline knowledge of how can we be more aware about the fundamentals, that is, and developing cross-cultural communication strategies, obviously with the goal of improving the patient-provider communication. So when we talk about the fundamentals, as I said, this is where we really begin to just establish the baseline for this conversation that we're going to have this afternoon. And there are a number of factors to consider. Cultural competence covers a lot of territory. What we'll talk about, these are again just sort of the tip of the iceberg around the conversation. And I'm one of those people who I'm always looking for resources to help me kind of tell the story or to get to the essence of what we want to accomplish, what we want to talk about. So I found this, what I thought was a great statement from UCLA, And it basically says there are many factors to consider, including language, cultural differences between yourself and your client. Now, in their case, this is from UCLA, they're talking about law clients, but it's very relevant. It's the same applies in the healthcare environment as well. So these differences can act as barriers, and this is where we have issues. Sometimes those barriers can cause us not to be successful in whatever that client or patient relationship is. And one of the takeaways, one of the fundamental things actually to keep in mind is that when we're talking about culture and cultural competence and how to deliver the best care to patients across cultures, is that we have to remember that one size does not fit all. Everybody's different and everybody is unique. So one of the important pieces for me to get the conversation started really around cultural competence is to define culture. Now, obviously, you have in your various roles and your various readings and trainings, you've seen a number of definitions of the word culture, but this is one that I thought really kind of summed it up quite well. And as we can clearly see, culture is very multidimensional. It includes so many things that we can't even list them all here, but it includes our language, our thoughts, the religious and social groups that we belong to. It involves our communication habits, our communication styles. What are expectations when we come to an interaction, in our case, a healthcare interaction? What do we expect to occur? What is considered appropriate? What is considered inappropriate when we are interacting with other people? So now that we have a definition, a workable definition around culture, let's think about what does culture define for us in a healthcare context. Culture helps us define each individual, define how we view health, how we communicate about health, and how we make health decisions. For example, culture dictates and defines when we seek health care. When do we seek to go to a health care provider? Do we get regular checkups? All of those things are defined by our culture. How comfortable are we with discussing health issues in front of what we consider strangers? Are certain topics not acceptable or not deemed appropriate rather within our culture? Is there a level of shame with certain illnesses? These are all things that culture defines in the healthcare environment. Now, culture is learned. Culture primarily is learned from our families. We can go back generations and realize that a lot of the things that we do, the people that we are, these things came from our families. The way we perceive health, healthcare, the healthcare experience, ethnicity, geographical, even where you live. If you live in a rural area, your culture is going to be a little different. If you live in a metropolitan area or a city dwelling, then also it's going to be different. Your culture is also shaped by your life experiences. As we are introduced to new people, new cultures in our life and in our lives and in our experiences, that also helps to shape our culture as well. Our beliefs, the social groups and so forth. Have you traveled? Have you lived abroad? That all shapes your culture. And as I said before, culture consists of multiple components. One of the, what I find an advantage of being a partner, being a part of the UAB community for so many years is that it is the culture is so varied, it's very diverse, and so you have many opportunities to meet people and to learn about different cultures and what some of their views are, and you can understand. And that's what a lot of cultural competence is about, is being able to understand and to accept and to appreciate and to have a level of respect for people from other cultures. And one of the points that I want to emphasize here is one of the bullets. This is mostly culture is an unconscious behavior, and that's because it's just who we are. We don't typically walk around every day saying, oh, well, I come from the culture of the South, or I'm part of the Alabama culture, or I'm a part of the UAB culture, or the African American culture in my case. It's just who we are, and that dictates how we view people and how we interact with people. So one of the key components of cultural competence is cultural awareness and sensitivity. And they're just two words that really, again, can help us to sum that up. And that's acknowledging that people are different, that people are unique. They bring unique beliefs, unique values, unique just points of view about care and what constitutes care and what constitutes illness. And the other word is respect. If we can all make a great effort, a concerted effort to have a respect for the beliefs and attitudes and cultural lifestyles rather, of our patients, then that in turn moves us a long way towards being culturally competent. Cultural sensitivity. We all have, I believe, a certain level of what we would consider unconscious bias, and even some stereotypes, for example. And some of the terms that I have here, these are statements that you can often hear people use, what I would consider derogatory and stereotypical terms. Them Mexicans, those people, and a lot of times that term is used for African Americans. And recently someone said to me in a conversation, they were talking about Hispanic, Latino, the community, and they used the term "those pesos." And I had not heard that one before. That one was new, but I knew exactly what they meant. And all they eat is rice. And unfortunately, that is a reference, or those types of references come from a mindset that some of us have when we're not culturally aware of the different cultures, and we tend to put people in these little pods. All they eat is rice, things like that. Of course, they're good in math, and that's usually a reference to some of our Asian community members. So again, I have a number of details on some of the slides, and absolutely I will not read them all to you because that will not be any fun, and I hope that you had an opportunity to print these out and can follow along with us. But I always try to include information that helps to tell the story of the point that we're on at the moment. So moving on, still with cultural sensitivity, we know that a part of being culturally competent is being sensitive, being able to have empathetic listening and putting forth a little extra effort to bridge the gap between the health provider and the healthcare organization, as well as the patients who bring those different cultures to the health encounter. But that's just really a good effort. Absolutely is appreciated, but it really needs to require more. There needs to be more effort so that we are able to measure our efforts a little bit better. They need to be measurable. So, cultural and linguistic competency. We have defined culture. We have identified what culture defines for us in a healthcare context. So with respect to defining cultural and linguistic competency, and that is a term that really came out of the U.S. Department of Health and Human Services many years ago when cultural competency came on the scene basically, or moved to the forefront of discussion about how to address healthcare disparities with respect to minorities. So this, I thought, I've used this particular definition in several of the workshops that I've done on cultural competency, and I think again, it sums up the topic quite well. And we think about it in terms of being able to master a set of behaviors, congruent behaviors, those behaviors that are in agreement with each other, those behaviors and attitudes and policies that are in agreement with each other in a system, within an agency, and among ourselves, the individual professionals, that allows them to be able to work effectively across cultural situations, cross-cultural situations. And so everything involved in cultural competency also includes the hiring. I mean, working towards having a diverse workforce so that the health provider, that's more likely that the health provider will look a lot like the patients or the patient population that it serves. Cultural competence, again, kind of moving a little bit further in that discussion. It really focuses on improving the quality of care and enhancing service delivery to a diverse patient population. And the idea really is to acquire baseline knowledge about various cultures in an effort to develop culturally competent health care and for us to be culturally competent health care providers. And also know that cultural competence now is extended beyond health care. There are great efforts put forth in the education system, in administration, in the law practice, and across other agencies and organizations, because people want to know, how can we better serve a diverse population? And we know very clearly, if we look at statistics, the U.S. Census Bureau information, that the United States is becoming more and more diverse, so we have to be in a better position and to be able to to know how to navigate through those cross-cultural communications or those cross-cultural situations, and that's where we are here. And I mentioned earlier that I wanted you, through as time permitted, I was going to ask you to jot down some questions and just for you to think about on your own time. And one of the questions that I'd like for you to do, to write down now, is to think about where are you on your journey regarding cultural competence. So like I said, just take a second if you would and write down where are you on your journey towards cultural competence. Cultural competence is a lifelong process. It's a journey. It isn't a destination, and I think sometimes that's one of the challenges that people face, is thinking, okay, we'll go through a certain series of steps, certain series of trainings, and voila, we're at the end result, we're culturally competent. But it's an ongoing process, and again, as the dynamics and as the demographics of the patient population changes, we have to continue to work towards cultural competence. And again, these are just some definitions or some attributes that I wanted to share with you around what cultural competence means. What does it look like? That's what these statements are for here. And I've included two items, one from the University of South Florida and the other from Healthy People 2010, which is a Department of Health and Human Services initiative. And over the years, I first started working with this topic really in 2007, and at that time there wasn't an enormous amount of literature. There weren't. Everybody was trying to catch up. There were some mandates. Everyone was trying to catch up. What do we do? How do we get on board with being culturally competent? And now, if you look at the literature, there's so many health many health stakeholders, that are or have developed initiatives in cultural competence. Dental schools, there's a plethora of literature just around dental schools, nursing schools, health organizations, even organizations like the CDC, universities, and health systems. So that is a great segue for us to say, okay, so now we know what culture is. We have a better idea of what it means to be culturally competent. So why is it even relevant? Why is it important in our discussion around health care? The number one reason is that, and I'm going to go back for just a second, is that at the bottom of this slide from Healthy People 2010, it says that cultural competence has been identified as one strategy for eliminating racial and ethnic disparities. So with that being said, that is the segue for us, is that as the country, as I mentioned before, as the country becomes more diverse, it is more and more important that we are able to bridge the gap between the different racial groups and ethnic groups in terms of the level of health care that they receive, and that's where cultural competence comes into play. I want to go to the second bullet that's on here, improved cross-cultural communication, because I don't know about you, but in my own health care, the relationship that I have with the healthcare provider is very important to me. And if you cannot communicate effectively across cultures, then the relationship is already minimized. And that, in turn, if you are able to communicate effectively, which we will talk about some strategies in just a few moments, that builds stronger relationships with you and the patient. And so that's one of the key components of why cultural competence is important in healthcare. And as well, improved health outcomes. If you have stronger relationships, if we have better communication, if the healthcare agency and the individuals are more culturally competent, then the patients are more likely to seek treatment, and then they are more likely, as research indicates, they're more likely to adhere to whatever the healthcare provider prescribes. So still moving along in that same conversation of why cultural competence is important and relevant is because based on our culture, we come to the health care setting with the different perceptions of illness and disease. They vary by culture. Take, for example, I have a relative, and I'm sure some of you that are visiting with us or participating with us today can probably say the same thing. I've had a number of relatives who are older African Americans. Most of them have lived in rural areas most of their lives, and they have a perception about when they should go to the doctor. And a lot of times they don't go until it's an acute situation or it's an emergency situation or various diseases have presented themselves. There's also a level of distrust that some people, especially in the African American community, there is a level of distrust between them and their health care providers. So that all, as I said, understanding where they are coming from and why they feel the way they do all leads to helping us to be a little bit more culturally competent. So moving along in that conversation, why is it important? One of the reasons is that we need to do a better job of hiring and staffing healthcare professionals that are diverse and inclusive. So again, as I mentioned earlier, there gives us an opportunity to have healthcare workers and healthcare providers that look more like or reflect more the communities that they serve. And then one of the other points that I want to mention here is that culture influences health-seeking behavior. I think the example that I gave, speaking of my own relatives, is the culture that people come from. Some cultures, they only they may use traditional or folk medicine before they come to an actual clinic or a health department to seek care. And all that goes back to their cultures, dictated by their culture. So we've already established, according to the Health and Human Services Department, that with cultural competence, we should be able to reduce health disparities. And so you should have, if you don't have this in the slide, I think it was made available to you as a handout, this particular diagram. And I thought it was a great diagram that shows you what the intent of or how it should work in theory. And there is research that indicates that the more culturally competent the healthcare providers are, that the better the health outcomes are, and that it is making an inroad into reducing health disparities. So if you think about it, your population that are diverse presents linguistically diverse, ethnically diverse, and culturally diverse. And so the idea is that if you implement some of the cultural competence techniques, for example, interpreter services, written translations. I know, for example, in the D.C. area, one of the health departments there, they are very mindful to create brochures and some of their literature in different languages because they know they have Koreans and so forth that are more heavily populated in their area. So to be more culturally competent, they provide materials and even their posters, informational and health promotion posters and literature and television ads and ads that go on the city buses and things like that, all are geared towards patients of diverse populations. And so the idea is if you take those two things, the diverse population plus cultural competence techniques, that you'll see some behavioral changes in both the clinician and in the patient. So that in turn, for example, improves communication. If we work really hard to improve our communication across cultures, that in turn moves us to the next part of the diagram, which means we are better able to give appropriate services for minority group members. That means they are more likely to seek preventive care, to participate in screenings, and the diagnosis should be more accurate, should be better and easier to accomplish. And then moving to the next part of it, with those things in place, we should see improved outcomes for minority groups. Their health status will change, for example. And then at the end of the day, as I said, obviously the goal is to reduce the health disparities among those minority and underserved or underrepresented groups. So this was just an opportunity to give you to see the slide a little different. And you should have this particular handout. It's called Purnell's Model for Cultural Competence. You should have it on a handout that will make it obviously a lot easier for you to see. And before we discuss it in detail, I want to just say that when he developed this, there are several assumptions that he was making. And one of the things that I liked about this model is it gives us a real picture, for the lack of a better word, gives you a great picture of just how dynamic culture is. And one of the things that I would recommend, actually in your handout, I've included the reference for this model where you can actually look at a couple of the chapters. In one of the books that it's in chapter 2. And so it goes into great detail about all of the assumptions that he used to build this model. He basically built this model just to help healthcare workers in particular to be able to analyze cultural data a lot better. And he goes into this with the idea that, well, first of all, I just want to share a couple of the assumptions that he makes. And like I said, for those of you who might be Google queens like I have deemed myself, you might be able to just go out and check into some of the literature and look at all of the 20 assumptions. But one of those assumptions that he made is that all healthcare professionals need similar information about cultural diversity. The second assumption is that one culture is not better than another culture. They are just different. And again, this goes back to the respect and the appreciation that and acknowledgement that we mentioned early on in the session today. And then another assumption that he makes is that cultural awareness improves the caregiver's self-awareness. So if we spend time, going through this model, for example, or others, learning a little bit more about different cultures, and I actually have some information for you on getting to know other cultures, then it just makes you more self-aware as well. So those are some of the assumptions that he makes. But if you look at the diagram or look at the image that you have, he starts with an outer band, and the outer band represents the global society. And his thinking there is that now with the with technology, with the internet, and with different things happening around the world, that we are not just the smaller society, we are more of a global society, and what happens globally affects what happens closer to the family and within our communities around healthcare. So even when you think about things like wars that happen in other areas, and then all of a sudden you have an influx of refugees from different countries that may present, they're going to enter into the healthcare system. So how are you better able to serve those patients? And there again, what was a global concern now becomes more of a community concern, and that's the second band, is the community. And the community, we can define it in a number of ways, but it's start out globally, then we come into the various communities, and then the next band that he has is the family. And the family obviously takes on a lot of definitions, and then from within the family we have the individuals, we have the different people. And so what he's done is he's created, based on these three outer bands that drives everything, he has developed this model around 12 domains of culture. He used this as what he calls an organizing framework, that all of these domains are interconnected. All of these are important for us to understand and better be able to evaluate the health encounter and how to better serve patients who come to us from different cultures. So there are 12 of those, and we obviously are not going to take the time to go through all of those today. I want to highlight a few of them because I just think that those are some that really kind of stands out to us. I'm going to highlight communication, family roles, and organization. We also will highlight a little bit on nutrition, and then on healthcare practices and practitioners for a few moments. So to move us into that discussion, when we think about family roles, what he's attempting to do here is to just say these particular elements play an important role in the culture of an individual, obviously, and they also impact that we have to think about these elements when we are thinking about the overall culture of an individual. So say, for example, on family roles, the head of household, in various cultures, the people that we may be used to being the head of household, and say in the Western culture and primarily United States, in different cultures, the head of household takes on a completely different role. Now, I know when I go to the doctor, and I know my friends who are married, when they go to the doctor, for the most part, they are making their own health decisions. But in some cultures, the husband, the decision is yielded to the husband, or if a health care worker shouldn't be totally alarmed if the wife insists on having a husband, even in the, I've had stories about, people wanting to bring their husband into the examination room with them, whereas for me, I would be like, oh no, I never want that to happen. But in some cultures, that's very, very acceptable, and it's actually, you would be seen as being insensitive if you insisted that the husband were removed from the room. So those are things that you have to navigate in those situations. So gender roles, men and women take on different roles in different cultures. As I said, most of us, we can gauge by our own culture in the United States, a Western community, where the roles in a lot of cases interchange, especially around health care. In some families, there are certain behaviors that are taboo. So when you're navigating through, trying to learn a little about different cultures, you want to learn what some of those behaviors are. And then alternative lifestyles, and that goes to not just same-sex couples and so forth, but unmarried people. In certain cultures, an unmarried woman is frowned upon. Certain things that she says and certain things that she might do. Being a single parent with children, living alone, blended families. These are all things that he's saying that we need to take into consideration when we are assessing the patients, a diverse patient, a culturally diverse patient that comes before us. And then the other piece that I want to talk about from his model is the meaning of food, or nutrition rather. And the meaning of food is one of those components. And the role in socialization that food plays. We know that I'm going to just speak for being in the South, we know that food becomes a part of everything. I don't know if we call it a ritual, but it's a part of everything we do. When there's a birth, there's food. When there's a wedding, there's food. In our social settings, food plays a very, very important part. But food also in certain cultures, we are, like in some cultures, hot and cold foods, and not necessarily hot based on heat, but certain foods are considered hot and cool, and that there's a belief that those foods either can contribute to your wellness or they can be a detriment to your wellness. And really and truly, the second two bullets should be combined. So common foods and rituals. What foods are included in a ritual as a part of a cultural customs, and what impact does that have on the healthcare environment? Deficiencies and limitations will also, those two really kind of go together. The way he presented them, they go together. And we think about deficiencies in terms of a couple of ways. Some diets, they are just considered, they lack the protein nutrition that needs to be included according to the U.S. Western health standards and food standards. And as well, some diets, some foods aren't available to certain cultures. If you come to the United States from a culture that is rich in certain foods and they're not available to you, or they are limited in supply to you, those are things too that we need to consider when we're in the healthcare setting. So then health promotion, wellness, illness, and disease prevention, health maintenance and restoration. These things are all important because different cultures view health promotion in a different way. Like, what does it mean to maintain your health? What does wellness mean to you? What does illness mean to you? And what should you be doing to prevent disease? And if you have a cultural belief that certain spiritual things may cause you to get diseases, or you've done something bad, these are all things that the healthcare provider needs to know. And an example of where we can kind of go awry when we're trying to navigate these waters is if we were to prescribe an American diet to Hispanic or Asian clients, then if some of the foods that's on that diet aren't their native food, or not foods that they typically would eat, then what kind of impact does that have on their adherence to, and then ultimately their health outcome? So here's another one of those questions that I want you to take a moment and write down. And this particular question is, what are some common foods that are in your culture? So take a moment and write this down. What are some common foods that are in your culture? And again, we're just building towards self-awareness about our own culture, so that in turn we can start to think a little bit more about other cultures and how they differ from us, but yet going into it with a level of respect. So what are some common foods in your culture? So one of the other domains in Purnell's model is high-risk behaviors. Certain cultures, we can make an assessment, are they more prone to more high-risk behaviors than others? Tobacco use, alcohol use, recreational drugs. And then around physical activity, I worked with one of the cardiologists at UAB several years ago on a study for the Robert Wood Johnson Foundation, where we went to rural Alabama, and we were working with African-American women, primarily trying to figure out what are their views on physical activity, and to them what constitutes physical activity. And it was quite amazing and quite interesting, actually, because We think of when I say we, those of us who primarily are city dwellers, we think about physical activity, going to the gym, going out to a park for a walk. You know, we have memberships at rec centers and gyms and so forth. But these women brought a different idea. They, for them, physical activity was the work that they did on a daily basis. They said, well, you know, I'm folding clothes, I'm bending and I'm stooping when I do that. You know, I'm walking my kids to school. But they had a completely different view of what physical activity was, and I found that to be very interesting. But these are the kinds of things that we have to consider. So again, we're talking about a difference in culture. They were African American women just like I am, but they were living, and most of them had always lived in a rural area, and their environment also had an impact on their physical activity as well. Like, I take for granted that there are sidewalks everywhere. They didn't have safe areas to even just go out for a walk. So healthcare practitioners is another one of his domains that I want to mention. And the perception of practitioners, this really deals with the status of healthcare practitioners. For example, some of the literature shows that the respect for nurses is actually in some cases much higher than it is for doctors. And in some cultures, if the doctor is seen as a high status person, this is a person of authority, then that might dictate how they interact. For example, and I don't want to get too far in our communication discussion just yet, but even eye contact. In some cultures, making direct eye contact with someone that is deemed at a higher status than you are is determined or is deemed inappropriate. So if you're in a healthcare setting and the person is not making direct eye contact with you, then you can't just assume that that person is not paying attention, they're not interested, or they didn't understand. It just may be all about respect for them. And gender in healthcare, I don't know about you, but this is one of those quick questions you can write down for yourself. Do you prefer a same gender practitioner for your general health care? Do you prefer a same gender practitioner for your general health care? And we all have our own views about that. I personally, for whatever reason over the years, have developed an idea that for the most part I prefer male doctors in almost all cases, and some of that comes from my experiences as well. But that's something to think about, and that's something we have to think about in the healthcare setting, is gender in healthcare. Some people or some cultures working with, they prefer that they work with the female. Again, if they're a female patient, they prefer that it be a female rather than a male, and it could be culturally based. So that's a great segue to us on communication. We mentioned communication around eye contact just a moment ago. And I won't read this slide. Hopefully, as I said, you have it in front of you. But this was just one I thought was a great statistic to just kind of sum up to us why communication is such an important piece of, such an important part of cultural competence. So I'm going to just jump right into, and I'm still in Purnell's model, and we actually have some of our own. We're going to talk a little bit more about cross-cultural communication strategies. But in his text, or in his model, he's actually puts dominant language and dialects together. So if you could think about those as two components, that would be very helpful. So when you're working with patients, you want to figure out what is their dominant language, and you have to take into consideration their dialects, because when you are when you're using interpreters, it's important to try to get interpreters that are dialect specific, because dialects, just like you may have Hispanic, Latino patients who speak Spanish, but there are different dialects to Spanish, so different words mean different things. Just like somebody that speaks Creole, even within just the Western culture, just standard English, there are some words, depending on where you live, some people may use slang, and certain words mean different things. So you have to be very, very conscientious of that. That in turn can cause difficulty in the communication process. And then your volume and tone, again, those are two things, two communication pieces that speaks to respect. If your voice is too high, or if a patient is speaking louder than you normally would, does that mean disrespect, or is that just how their culture works? And then I want to talk about spatial distancing, because in the Western culture, for Americans, for the most part, we are what we would consider more or less a low contact culture, where we believe in having our own space. We are more individualistic. So for us, mostly we expect to have 18 inches of space around us, like our own little bubble. Even if you're in the grocery store, this will give you a visual. If you've ever been in the grocery store and somebody comes behind you with their cart and then all of a sudden they're up on your heels, you probably will turn around and give them a funny look like, okay, you're too close to me, you need to back away. So that's just your culture dictating through a nonverbal communication that you need more space. And so that holds true personal space when you're working with patients. What's considered too close, and do you need to back away a little bit? And so eye contact, in the American culture, we expect people to make eye contact, to make direct eye contact. If you don't, you're seen as not being trustworthy and uncaring. So in some cultures, maintaining eye contact, as I mentioned before, with people who are perceived as being in a higher status, can be seen as something that's negative. So then also facial expressions, and I want to just talk about greetings. The handshake in the American Western culture, for the most part, is seen as a sign of respect, but in some cultures that's not necessarily that it can be frowned upon. So moving along, time means different things in different cultures. There are actually some cultures where the patients are just seen whenever they get to the appointment. In the Western culture, obviously, we are very much about being on time. If your appointment is at 11, you're expected to be there a few minutes before. And in some cases, we now charge a fee if you present late or if you miss an appointment. So those are things also to keep in mind. And touch, what's appropriate, what's perceived as inappropriate. How close should you be? In some cultures, can another male person touch a married female from different cultures? So those are things that we have to think about as well. All right, so getting to know other cultures. In your handout, you have, or if you haven't printed it already, I hope that you'll take time to do that. What I've done, I did this several years ago. I created basically this grid that identifies different cultures, and what we do, what the intent of that tool was, as we learn more about other cultures, these are some things that we need to consider. Their primary language. What are their attitudes and beliefs about illness? The diet, nutrition, traditional folk medicine, what are their views on that, and what are their communication styles? And as you'll see, there's a lot of parallel here to what is in Purnell's model as well. So you will have that as a handout that you, at your own leisure, you'll be able to kind of go through that. Like I said, it's just really a tool. It's just a resource that we didn't need to include here. So cultural courtesies is something that you need to think about, and that's on the handout as well. And what constitutes the family structure? What are you most likely to see? So now we get to effective cross-cultural communication strategies. And we know that communication is very, very important in everything that we do. And it's actually the very first challenge in a diverse interaction. And I'm sure those of you who are participating with us today, you can think about almost probably very easily, you can think about a time when you were in a situation when communication was actually was not either not understood, not very well understood because of that diversity. The point you want to get to is that clear understanding has to happen. So for the sake of time, I'm going to just kind of mention some of these. We've talked about eye contact already a little bit, nonverbals, things like touch and what's appropriate, inappropriate, and communication apprehension. Don't be alarmed if your patients aren't open to communicating. They may just, be a little fearful about communicating with people across cultures as well. So cross-cultural communication, again, these are just some points that I wanted to mention. Patient-centered communication, for example, it's very important to focus on the patient and making sure that the patient has clear communication, clear understanding about what the disease is, the illness, the diagnosis, or what the instructions are, or what they're supposed to do in terms of self-care. And these are some of the goals around cross-cultural communication. And obviously the general goal is to facilitate communication among members of diverse groups, and that's what these next slides represent. Just how can we facilitate, what tools can we use to facilitate effective communication across various cultures. So here's that word respect again, respecting values and beliefs and practices, seeing diversity as an asset, not a hindrance in the communication process. And this just means that we have to really work hard to appreciate the richness of diversity. What can we learn from others from different cultures? And then there are some, I liked these. These are some, what I consider these are just some elements of effective cross-cultural communication. Again, these are some more specific strategies that you can use. For example, limiting the number of messages because you can overwhelm. And if you already have communication as a barrier, you want to put your messages in chunks. You want to give one, maybe 2 or 3 key messages, but not pour in a lot of information, because if there's a cultural communication barrier, rather a language barrier, then it already makes it really hard for you to communicate clearly. Use jargon-free language. That just means keeping it simple. Just use plain language so that the patient can understand, or the interpreter can make sure that the patient understands if you are in that situation. And then you want to be flexible. You can't always use a script. You'll have to be flexible and adapt to the patient that is presenting to you. And these, again, are some other strategies. We mentioned body language and other nonverbals. Choosing a speaking rate and a style that promotes understanding. So if you typically talk really fast, you need to slow it down. But one of the things that we see people do is, if they are in a cross-cultural with the communication barrier, they tend to want to speak loudly, thinking that that will make the person understand, but it doesn't. So yelling at the person does not accomplish what we're trying to do here. And you want to use open-ended questions so that the patient doesn't just get away with saying yes or no or nodding, and then you assume that they have acceptance or they have understanding. So you want to give them an opportunity to explain and speak directly to the client. And so there again, even if you are using an interpreter, speak directly to the client and not to the interpreter. And these are, again, just some other, I want to highlight here, using pictures. I myself appreciate when the doctor drew a picture for me on something a year or so ago, because it helped me to really see what was going on. And so use pictures as you need to, or draw, but again, you're going to use different techniques to make sure that you get full understanding to the patient and back from the patient. Create a welcoming environment, beginning with the person on the intake, person at the front desk, the literature that's throughout the office, the posters or whatever. You want to make sure that those things say that we welcome people from all different cultures. And our next, as we get to the close, we want to think about what are our next steps for advancing cultural competence. Obviously, we want healthcare organizations, medical schools, healthcare stakeholders to redouble our efforts to increase awareness. Just be aware of the disparities that exist. Work to enhance diversity in health professions. That means more diverse students coming into health professions, making sure that there is additional training as well. And we want to continue those efforts. Some of the other things is we definitely will have to collaborate with other sectors of society. That includes doing community outreach so that you can find out what's going on in the community. What can you do to be more accessible to your community, that diverse community that you are operating in. Some other next steps is we have to take some personal responsibility in this quest to be more culturally competent. And it starts at an individual level, but as well, it needs to happen at an organizational level. So what is your personal responsibility? Some of the questions that I've asked you to kind of write down today is to get you to start thinking about where you are and what is your personal plan to address cultural competence. And if you are a manager or a leader in a healthcare setting, then what can you do from an organizational perspective? What kind of policies can you implement? Can you recruit a more diverse workforce that, again, more closely represents the population that you serve? And in your handout, I want to make sure that you take an opportunity to see the personal reflection handout that I attached. And it's a one-page, and it's a really quick little form that helps you to do that self-assessment to see where you are in that sort of continuum of cultural competence. And speaking of self-awareness and self-exploration is extremely important in order for us to be able to adapt to the diverse cultures that we work with, and for us to be able to have a level of respect for those cultural differences and really understand what the patient brings to the table. One of the questions that I'd like for you to write down for yourself right now is list the various cultures that you belong to. So it's a question for you to write down, and this is all part of your self-awareness, self-exploration process. List the various cultures that you belong to. And also I will just add that the American Association, or AAMC, has a wonderful tool for organizations to do an assessment of cultural competence training as well that should be helpful. And when you are listing the various cultures that you belong to, think about what your biases are, because that's part of the self-awareness, self-exploration process, is doing the self-assessment, but asking yourself what kind of biases do I bring to the table as well. So what are some of the cultural competence best practices? I've provided a list for you. These are some conceptual models that will help you, hopefully, from an organizational perspective. And obviously, we'll not read these to you. Hopefully, you've printed them out or will get to at some point. But these are just some of the best practices that we've seen. For example, the Office of Minority Health has a number of initiatives, and they've partnered with various universities and health systems around the country and other health organizations around the country. And these are some of their initiatives as well. For example, the study of interpreter services with Portland State University. Another piece to this is Communities in Action, and one that I think is really good that everyone should take an opportunity to look at is the University of Michigan's Health System Program for Multicultural Health. They have quite a few resources as well. And the Washington Department of Public Health has some resources. The University of Kansas has done a lot. They've actually created a community tool, and all of these things are listed on your handout. So if you'll see those resources for additional readings and just some resources to help you on your individual quest as well as your organizational quest, I think that you won't be disappointed. So that gets us to the end of my part of it. And again, I appreciate the opportunity to be here, and I appreciate all of you tuning in and being a part of this afternoon. So I'm going to take it back to Ms. Elena, our facilitator at this point.
Well, Ms. Ward, you know, we really appreciate this information because it is so important that we are culturally aware, culturally competent, but also culturally sensitive within the healthcare profession, but also within our personal lives and other cultures that we interact with as well. And, you know, one thing that really stood out for me was the importance of the consideration of language and the different dialects and the different interpretations, but also how different cultures within the healthcare setting are viewed differently.
Yes.
And I think having a clear understanding of that can also help us with better service delivery, effective service delivery.
Absolutely.
To hopefully improve patient satisfaction and better health outcomes.
Absolutely, absolutely. So we can reduce the disparities that we're seeing.
Right. So
yes.
that's something that's really important. So I just kind of want to wrap up and close with something that you mentioned earlier on about, and I kind of labeled it the lifespan continuum, the life spectrum, where cultural competency occurs over the course of a lifetime.
Absolutely.
Okay, and
yes.
we're continuously learning and growing as we engage and expand our horizons as we work with different cultures.
Absolutely.
To learn more about their norms and their values and different beliefs and how to address that as well. So as we close, do you have any closing comments or anything that you'd just like to share? Because you've encouraged us to think about quite a few different questions.
Yes,
so,
yes.
As we close, what would you like to share to encourage people to think more about as we move forward?
Well, I think, and just to reiterate a couple of things, I talked a little bit about, well, several times about the self-awareness, that we have to be aware of self, because, again, our culture is just like the diverse cultures that we're working with, in that we don't walk around thinking about it every day. We only think about it sometimes when we're up against or we're in where somebody's different than we are. But I think what we have to do is to step away from letting our culture be sort of the benchmark, that, you know, we can't think that, okay, our culture, this is the only way, and just being sensitive really about little things on a daily basis, you know, responses to the way somebody looks, to what they eat, and those kinds of things, just being sensitive to that, or the way they talk. You know, you hear derogatory, disparaging remarks. So I think if we can just make some efforts on a daily basis on little things, and then really put forth some effort to look at these different resources to help us in our professional worlds to become more culturally competent.
Well, we really appreciate that, and we just kind of want to wrap up and just say it's so important to know thyself.
Yes.
Know thyself as we move forward, so that we can better understand what other people are experiencing, and hopefully that will help us in better serving and assisting the people that we work with.
Absolutely, seeing it from somebody else's point of view.
Absolutely. So
Yes.
thank you so very much.
Thank you all
for your willingness to share this information on today. This concludes today's program, Towards Cultural Competency, a conversation for healthcare leaders and managers. The program will be available on demand at the website on your screen. Thank you to our presenter for being here, and thank you for watching this program. We hope you have a great day.